A nurse was terminated for practicing meditation with a dying cancer patient. What happened next defied every medical textbook and changed the entire hospital forever. This is the extraordinary true story of Sarah Chen and how one moment of compassion transformed into a miracle that left doctors speechless. Before we jump back in, tell us where you're tuning in from, and if this story touches you, make sure you're subscribed, because tomorrow I've saved something extra special for you. The fluorescent lights of Riverside General Hospital's oncology ward hummed their familiar tune as Sarah Chen adjusted her stethoscope and checked her watch. It was 9:47 p.m. on a crisp October evening in Chicago, and the 7th floor carried that particular stillness that comes with the night shift. Sarah had been working these halls for 4 years, long enough to know that the quiet moments were precious. In oncology, peace was often temporary, and hope was sometimes all that stood between families and despair. At 29, Sarah possessed the kind of gentle strength that made patients feel safe. Her colleagues respected her clinical skills, but what set her apart was something harder to quantify. She listened differently. She touched patients' hands. When she spoke to them, she remembered their grandchildren's names and asked about their gardens. In a world of protocols and procedures, Sarah never forgot that healing involved more than medicine. That evening, as she completed her rounds, Sarah found herself pausing outside room 714. Inside, David Thompson lay sleeping fitfully, his 58-year-old, frame diminished by months of aggressive treatment for stage 4 pancreatic cancer. His wife, Margaret, sat in the bedside chair, holding his hand and staring out the window at the city lights below. They had been married 32 years, and Margaret hadn't left his side since the diagnosis 6 months ago. Sarah knocked softly and entered. Margaret looked up with tired eyes that still held traces of hope, though the oncology team had been preparing them for the inevitable. Dr. Robert Martinez, the department head, had delivered the news 3 days earlier with clinical precision. The latest scans showed the tumors had continued growing despite the most aggressive treatments available. David had perhaps 2 weeks left. "How are we doing tonight, Mr. Thompson?" Sarah asked quietly, checking his IV line and noting his labored breathing. David's eyes fluttered open, focusing on her with effort. "Been better, Sarah," he whispered, managing a weak smile. "Margaret's been reading me poetry again. Thinks it'll cure me faster than all these drugs." His attempt at humor broke Margaret's composure slightly, and she squeezed his hand tighter. Sarah had grown attached to the Thompsons over the past 3 months. David had been a high school history teacher for 30 years before his retirement. Margaret was a librarian who brought a different book each day, reading aloud during the long hours of treatment. They were the kind of couple that finished each other's sentences and still held hands after 3 decades together. "Poetry might not cure you," Sarah said, adjusting his pillows, "but it certainly can't hurt. Sometimes healing comes from places we don't expect." She paused, studying his face. "David, can I ask you something? Have you ever tried meditation?" Margaret looked surprised. "Meditation? We're not really the meditation type, dear. We're pretty traditional when it comes to these things." David, however, seemed curious. "I've heard about it. My grandson mentioned something about mindfulness at school. Said it helps with stress. Why do you ask?" Sarah glanced toward the door, making sure they were alone. "I've been studying complementary healing approaches in my spare time. There's growing research about meditation's effects on the immune system and pain management. I know Dr. Martinez prefers to stick to conventional treatments, but I've seen some remarkable results when patients combine traditional medicine with mindfulness practices." "What kind of results?" David asked, his voice gaining strength for the first time in days. "Pain reduction, better sleep, improved quality of life. Some studies even suggest that deep meditation can influence cellular healing processes. I'm Not saying it replaces medical treatment, but it can work alongside it. Sarah sat down on the edge of the bed. The hospital doesn't officially endorse these methods, but I've helped a few patients learn basic techniques. Would you be interested in trying? Margaret looked skeptical. We trust Dr. Martinez completely. He's been very clear about David's prognosis and treatment options. And I respect Dr. Martinez tremendously, Sarah said. This wouldn't interfere with his treatment plan at all. Think of it as an additional tool for comfort and healing. Meditation has been practiced for thousands of years, and modern science is finally catching up to what many cultures have always known about the mind-body connection. David struggled to sit up slightly. What would it involve? Simple breathing, exercises, guided visualization, and techniques to help your body enter a deeply relaxed state. The goal is to activate your parasympathetic nervous system, which is when your body does its best healing work. It might help with the pain and nausea from treatment, and who knows what else. Margaret remained hesitant. What if Dr. Martinez finds out? We don't want to do anything that might jeopardize David's care. Sarah understood her concern. Dr. Martinez was old school, brilliant but rigid in his approach to oncology. He believed in evidence-based medicine exclusively and had little patience for what he considered alternative nonsense. Sarah had heard him dismiss meditation as placebo effect, masquerading as treatment. Dr. Martinez doesn't need to know, Sarah said carefully. This would be between us during my night shifts when he's not here. It's not a treatment in the medical sense, just a relaxation technique, like prayer or listening to music, which patients do all the time. David looked at Margaret, and something passed between them. Honey, what do we have to lose? I'm not getting better with the regular treatments. Maybe Sarah's right about trying something additional. Margaret's resistance softened as she saw the first glimmer of hope in her husband's eyes in weeks. If you think it might help, and if Sarah thinks it's safe. It's completely safe, Sarah assured them. We'll start with just 10 minutes of breathing exercises. If you're comfortable with that, we can gradually introduce visualization techniques. The whole point is to help your body remember how to heal itself. David nodded slowly. Let's try it. Sarah dimmed the lights and pulled her chair closer to the bed. Close your eyes and focus on your breathing. Don't try to change it. Just notice it. Her voice took on a calm, measured quality. Now, I want you to breathe in for 4 counts, hold for 4, and exhale for 6. Let's start together. For the next 15 minutes, Sarah guided David through a simple meditation focused on breathing and progressive muscle relaxation. She watched his face soften, his breathing deepen, and his body visibly relax into the bed. Margaret observed, quietly, her own tension easing as she watched her husband find peace for the first time in months. How do you feel? Sarah asked as they finished. David opened his eyes slowly, looking genuinely surprised. Better. I actually feel better. The pain in my side isn't as sharp and my mind feels clearer. Margaret reached for his hand. Your color looks better too, sweetheart. Sarah smiled. That's the parasympathetic nervous system at work. When we're in deep relaxation, our bodies can focus on healing instead of just surviving stress and pain. They talked quietly for a few more minutes before Sarah had to continue her rounds. As she prepared to leave, David called her back. Sarah, thank you. I haven't felt this hopeful in months. When can we do this again? Tomorrow night, if you'd like. We can build on what we started tonight. Over the following week, Sarah spent 30 minutes each night teaching David more advanced meditation techniques. She introduced visualization exercises where he imagined healing light flowing through his body, dissolving the tumors cell by cell. She taught him breathing patterns that traditional healers claimed could influence cellular regeneration. Most importantly, She helped him cultivate a profound sense of inner peace that seemed to transform his entire approach to his illness. Margaret began joining the sessions, learning techniques to manage her own stress and anxiety. The change in both of them was remarkable. David's appetite improved. His pain levels decreased to the point where he requested less morphine. His sleep became deeper and more restorative. The nursing staff began commenting on his improved mood and energy levels. Sarah documented everything carefully in her personal journal, noting changes in David's vitals, pain scores, and overall condition. She wasn't making medical claims, but she was observing correlations that fascinated her. During their meditation sessions, David's heart rate variability improved, his blood pressure stabilized, and his oxygen saturation increased. By the second week, something extraordinary began happening. David's latest blood work showed improvements that puzzled the medical team. His inflammatory markers were decreasing, his white blood cell count was improving. Most surprisingly, his tumor markers were beginning to drop for the first time since his diagnosis. Dr. Martinez initially attributed these changes to a delayed response to treatment, but privately he was confused. David's case had been progressing exactly as expected for end-stage pancreatic cancer. These sudden improvements didn't fit the typical disease trajectory. Sarah continued the meditation sessions nightly, always careful to avoid detection. She varied the times slightly and kept their activities quiet. During their third week together, David began reporting unusual experiences during meditation. He described sensations of warmth flowing through his body, particularly around the tumor sites. Preparing and narrating this story took us a lot of time, so if you are enjoying it, subscribe to our channel. It means a lot to us. Now back to the story. He felt what he called energy shifts that seemed to correspond with pain relief. "I know this sounds strange," David told Sarah one evening, "but during tonight's meditation, I felt like something was actually changing inside me. Not just emotionally, but physically. Like my body was remembering how to fight this disease." Margaret nodded enthusiastically. "I've been watching him during these sessions, Sarah. Sometimes his breathing becomes so deep and peaceful that he looks like a different person. And afterward, he has energy I haven't seen in months." Sarah was documenting remarkable changes. David's pain scores had dropped from an 8 out of 10 to a 3. His appetite had returned to nearly normal levels. He was sleeping through the night without the restless discomfort that had plagued him for months. Most significantly, his mental clarity and emotional stability had improved dramatically. The meditation techniques they were using went beyond simple relaxation. Sarah had been studying traditional healing practices from various cultures, learning about visualization methods that practitioners claimed could influence cellular processes. She taught David to imagine his immune system as an army of light, systematically identifying and eliminating cancer cells. She guided him through exercises where he visualized his organs returning to perfect health, his energy levels restoring, and his body regenerating at the cellular level. During their fourth week of sessions, David experienced what he could only describe as a breakthrough. During a particularly deep meditation focused on cellular healing, he reported feeling warmth spreading throughout his abdomen, accompanied by a sense of profound transformation. "It was like my body was rewiring itself," he told Sarah the next morning. "I've never experienced anything like it. I felt connected to something larger than myself, and somehow I knew that healing was happening." That same week, Dr. Martinez ordered another round of scans, expecting to discuss hospice care options with the family. The results would change everything, but Sarah had no idea that their quiet healing sessions were about to collide with hospital policy in a way that would threaten everything she had worked for. 3 doors down from David's room, Dr. Martinez was reviewing charts and growing increasingly puzzled by David Thompson's case. The patient's improvement defied medical explanation, and Martinez prided himself on understanding every aspect of his patient's conditions. He made a mental note to investigate further. Meanwhile, Sarah prepared for another meditation session, unaware that Dr. Martinez had decided to make an unscheduled evening round to observe David's mysterious improvement firsthand. The collision between traditional medicine and Sarah's unconventional approach was imminent, and the consequences would test everything Sarah believed about healing, compassion, and the courage to challenge established medical practice. As Sarah entered room 714 that evening, she had no idea that within 24 hours her career would be in jeopardy, her methods would be under scrutiny, and David Thompson's case would become the center of a medical controversy that would ultimately change how Riverside General Hospital viewed the relationship between mind, body, and healing. Dr. Robert Martinez had built his reputation on precision and predictability. For 23 years, he had treated pancreatic cancer patients with methodical consistency, following established protocols that yielded expected outcomes. He understood disease progression patterns like other people understood their morning routines, which is why David Thompson's sudden improvement bothered him more than he cared to admit. Martinez walked the halls of Riverside General at 11:30 p.m., something he rarely did. His usual practice was to review charts from his office, but tonight felt different. The Thompson case had been gnawing at him for days. The patient's lab results showed improvements that contradicted everything Martinez knew about advanced pancreatic cancer. Tumor markers declining, inflammatory responses decreasing, pain management improving without increased medication. It was medically inexplicable. As he approached room 714, Martinez heard something unexpected. A soft, rhythmic voice speaking in measured tones. He paused outside the door, listening carefully. Through the slightly open doorway, he could see Sarah Chen sitting beside David's bed, speaking in gentle, flowing sentences about breathing and visualization. Margaret Thompson sat in the corner chair, eyes closed, following along with whatever guided exercise was taking place. Martinez stepped closer, straining to hear the words. Sarah was instructing David to imagine healing light flowing through his abdomen, to visualize his immune system strengthening, to breathe in restoration and exhale toxins. She spoke about cellular regeneration and the body's innate wisdom to heal itself. Martinez felt his jaw tighten. This was exactly the kind of unscientific nonsense he had spent his career opposing. He watched for another 10 minutes as Sarah guided David through what appeared to be an elaborate meditation session. David's breathing had become deep and regular, his face peaceful in a way Martinez hadn't observed during medical examinations. Margaret looked more relaxed than she had since her husband's admission. Whatever Sarah was doing, it was clearly affecting both patients and family members. Martinez retreated to the nurse's station and pulled David's complete file. He cross-referenced the timeline of medical improvements with the nursing shift schedules. Sarah Chen had been David's primary night nurse for the past month. The correlation between her presence and David's unexpected improvements was impossible to ignore. The next morning, Martinez arrived early and requested an immediate meeting with Patricia Williams, the chief of staff. Williams had been expecting this conversation. She had noticed the unusual improvements in David Thompson's case and had been monitoring the situation carefully. "Patricia, we have a problem," Martinez began, settling into the chair across from her desk. "One of our oncology nurses is practicing alternative medicine on a terminal patient without authorization or supervision." Williams set down her coffee cup. "Sarah Chen, you know about this? I've been aware of some unusual developments with the Thompson case. What exactly did you observe?" Martinez described the meditation session he had witnessed, emphasizing what he saw as clear violations of hospital protocol. She's filling a dying man's head with false hope while practicing unlicensed therapeutic techniques. This is a liability nightmare waiting to happen. Williams had worked with Martinez long enough to understand his perspective. He was a brilliant oncologist who had helped thousands of patients, but he viewed medicine through a very narrow lens. She also knew Sarah Chen's reputation as one of their most compassionate and competent nurses. Has Mr. Thompson complained about her methods? Williams asked. That's not the point. The point is that she's overstepping her scope of practice and potentially interfering with proper medical care. What if the family decides to pursue legal action based on false promises she's made? What if other nurses start thinking they can practice whatever alternative therapy strikes their fancy? Williams understood his concerns, but she also understood the complex dynamics of patient care. What are you recommending? Immediate termination. We cannot allow nurses to practice outside their training and certification. If we don't address this decisively, we're setting a precedent that undermines medical authority and puts the hospital at risk. Williams agreed to review the situation thoroughly. That afternoon, she conducted interviews with David and Margaret Thompson, carefully documenting their perspective on Sarah's methods. What she discovered complicated the situation significantly. David Thompson was more alert and articulate than he had been in months. His pain levels had decreased dramatically, his appetite had returned, and his overall quality of life had improved beyond anything the medical team had predicted. Margaret described the meditation sessions as the most hopeful and healing experiences they had shared since the diagnosis. Sarah saved my husband's life, Margaret told Williams emphatically. Not just medically, but emotionally and spiritually. She gave us tools to cope with this disease that no doctor or medication could provide. Whatever she's doing, it's working. David was equally enthusiastic. I understand Dr. Martinez's concerns about medical protocols, but Sarah never promised to cure my cancer. She taught me techniques to manage pain, reduce anxiety, and maintain hope. The improvements in my condition are as surprising to me as they are to anyone else. Williams found herself caught between competing priorities. Martinez represented the hospital's commitment to evidence-based medicine and regulatory compliance. The Thompsons represented patient satisfaction and measurable health improvements. Sarah represented the growing movement toward integrative medicine that many progressive healthcare systems were beginning to embrace. That evening, Williams called Sarah into her office. Sarah arrived knowing the meeting would determine her future at Riverside General. She had prepared herself for this moment since beginning the meditation sessions with David. Sarah, I need you to explain exactly what you've been doing with Mr. Thompson, Williams began. Dr. Martinez has raised serious concerns about your methods. Sarah chose her words carefully. I've been teaching Mr. Thompson basic relaxation and breathing techniques to help him manage pain and anxiety. Everything I've done has been supplementary to his medical treatment, never replacing it. I've documented our sessions in my personal notes and can provide detailed records of his responses. These aren't techniques covered in your nursing training or authorized by hospital protocol. That's correct. I've been studying complementary healing approaches on my own time because I believe they can enhance patient care when used appropriately. I've seen remarkable results with several patients, including Mr. Thompson. Williams reviewed Sarah's personnel file. 4 years of exemplary service, outstanding patient satisfaction scores, consistently positive peer evaluations. She was exactly the kind of nurse the hospital wanted to retain, but Martinez's concerns about liability and protocol violations were legitimate. Sarah, I appreciate your dedication to patient care, but I'm sure you understand why Dr. Martinez is concerned. You're practicing therapeutic techniques outside your scope of certification. From a legal and regulatory standpoint, this creates significant risks for the hospital. Sarah felt her career slipping away, but she remained composed. "Mrs. Williams, I understand the concerns about protocol, but I also understand that healing involves more than just treating disease. Mr. Thompson's improvements are documented and measurable. His pain scores, sleep quality, appetite, and overall well-being have all improved significantly since we began the relaxation sessions. Those improvements could be attributed to delayed treatment responses or natural disease fluctuations. They could be," Sarah agreed, "but they also correlate directly with the introduction of meditation practices. I'm not claiming to cure cancer, but I am demonstrating that mind-body techniques can enhance conventional treatment and improve quality of life." Williams appreciated Sarah's thoughtful response, but the institutional pressure from Martinez and the medical board was substantial. "Sarah, I'm going to need you to discontinue these sessions immediately. We'll be conducting a formal review of your methods and their appropriateness within our care guidelines." Sarah felt the ground shifting beneath her feet. "What about Mr. Thompson? These sessions have become an important part of his daily routine. He looks forward to them and has expressed how much they help him cope with his condition. Mr. Thompson will continue receiving excellent medical care from our oncology team. Dr. Martinez will ensure that all his needs are met according to proper medical protocols." Sarah knew this was essentially the end. Hospital reviews of unauthorized nursing practices rarely resulted in exoneration. Martinez would push for termination, and Williams would be forced to support medical authority over nursing innovation. That night, Sarah conducted what she knew would be her final meditation session with David Thompson. She chose not to tell him about the administrative review, not wanting to burden him with concerns about her employment when he was focusing on healing. They spent an hour together working through advanced visualization techniques. David had progressed to the point where he could achieve deep meditative states within minutes, accessing levels of relaxation and inner awareness that consistently produced measurable improvements in his vital signs and comfort levels. "Sarah, I don't know how to thank you for what you've taught me," David said as they concluded. "These sessions have given me back my sense of hope and control. Whatever happens with my treatment, I feel prepared to face it with peace." Margaret squeezed Sarah's hand. "You've been an angel to our family. I don't know what we would have done without your guidance and support." Sarah smiled, memorizing their faces and this moment of connection. "You've taught me as much as I've taught you. Watching your courage and dedication to healing has reminded me why I became a nurse." 3 days later, Sarah received notification that her employment with Riverside General Hospital was terminated effective immediately. The formal letter cited violations of nursing scope of practice, unauthorized therapeutic interventions, and failure to follow established medical protocols. Dr. Martinez had successfully argued that allowing such practices would undermine medical authority and create legal liability for the institution. Sarah cleaned out her locker during the day shift when fewer people were around. Several colleagues approached her privately to express support and regret about the decision. Jessica Rodriguez, her closest friend among the nursing staff, was particularly upset. "This is completely unfair," Jessica said. "Everyone knows you're one of the best nurses in the hospital. What you did with Mr. Thompson was beautiful and healing. Martinez is just threatened by anything he can't control or understand." Sarah packed her stethoscope, her personal medical references, and the small succulent plant she had kept on her desk. "I knew the risks when I chose to help David learn meditation. I don't regret it, even if it cost me my job. What will you do now?" "I'm not sure yet, but I learned something important through this experience. Traditional medicine has tremendous value, but it doesn't address all aspects of healing. Maybe this is an opportunity to explore different ways of helping people." As Sarah walked through the hospital lobby for the last time as an employee, she felt a complex mixture of sadness and liberation. She had lost her job, but she had gained clarity about her calling as a healer. The meditation sessions with David had confirmed her belief that healing involved mind, body, and spirit working together in ways that medical textbooks barely acknowledged. Dr. Martinez, reviewing charts in his office, felt satisfied that he had protected medical standards and hospital protocols. He expected David Thompson's condition to stabilize at the levels consistent with advanced pancreatic cancer, now that the patient was receiving purely conventional care. What Martinez didn't anticipate was that David Thompson had internalized the meditation techniques so thoroughly that he continued practicing them independently. The foundation Sarah had built over 4 weeks of guided sessions had given David tools he could use autonomously. His body had learned to access healing states without external guidance. Over the following week, David's condition continued improving in ways that defied Martinez's expectations. His latest scans would reveal changes that would force the entire medical team to reconsider everything they thought they understood about cancer treatment and the role of mind-body interventions in healing. Meanwhile, Sarah had no idea that David's remarkable recovery was about to attract attention from medical researchers, hospital administrators, and healthcare innovators who were searching for new approaches to cancer treatment. Her termination had removed her from Riverside General, but it had not ended her impact on David Thompson's healing journey. The meditation techniques she had taught him were about to produce results so extraordinary that they would challenge the fundamental assumptions of conventional oncology and ultimately bring Sarah back into the medical community in ways she never could have imagined. Patricia Williams had been monitoring David's case closely since Sarah's termination. The patient's continued improvement was creating conversations throughout the hospital about the potential connections between his meditation practice and his unprecedented recovery. Williams was beginning to wonder if the hospital had made a serious mistake in dismissing the nurse who had introduced these techniques. The collision between traditional medicine and integrative healing approaches was far from over. In fact, David Thompson's case was about to become a medical phenomenon that would force Riverside General Hospital to confront uncomfortable questions about the limitations of conventional treatment and the untapped potential of mind-body medicine. Sarah Chen sat in her small Lincoln Park apartment, staring at the morning light filtering through her kitchen window. 3 weeks had passed since her termination from Riverside General, and she was still adjusting to the strange rhythm of unemployment. Her savings would carry her for another month, maybe 2 if she was careful, but the real challenge wasn't financial. It was the emptiness of not being able to practice nursing, not being able to help patients heal. Her phone had been remarkably quiet. Word traveled fast in Chicago's medical community, and her termination for practicing unauthorized therapeutic techniques had made her radioactive to most healthcare institutions. 2 hospitals had called initially, but both withdrew their interest. After speaking with her references and learning about the circumstances of her departure from Riverside General, Sarah had spent the weeks researching integrative medicine programs and alternative healing centers. She was beginning to consider leaving traditional healthcare entirely when her phone rang with a number she didn't recognize. Sarah Chen, this is Margaret Thompson. I hope you don't mind that I got your number from Jessica Rodriguez. Sarah's heart jumped. Margaret, how are you? How is David? That's why I'm calling, dear. Something extraordinary is happening, and we need to tell you about it. Margaret's voice carried an excitement that Sarah hadn't heard since before David's diagnosis. The doctors are calling it medically impossible, but David's latest scans show that his tumors have shrunk by 60%. Dr. Martinez keeps ordering new tests because he says the results can't be accurate. Sarah felt dizzy. 60%? In 3 weeks. The cancer markers in his blood work have dropped to nearly normal levels. His pain is completely gone without any medication. He's gained 12 pounds and has more energy than he's had in years. Sarah, the meditation techniques you taught him, he's been practicing them every day, sometimes for hours at a time. Sarah, grip the phone tighter. What are the doctors saying? Dr. Martinez is baffled. He keeps insisting that spontaneous remissions don't happen with pancreatic cancer, especially not this rapidly. But Dr. Foster, one of the younger oncologists, has been asking David detailed questions about his meditation practice. She seems to think there might be a connection. Dr. Amanda Foster was indeed intrigued by David Thompson's unprecedented recovery. As a recent graduate of Northwestern University's integrative medicine program, she had studied the emerging research on mind-body healing interventions. Unlike Dr. Martinez, she didn't dismiss the correlation between David's meditation practice and his medical improvements. Foster had spent considerable time reviewing David's complete medical history, looking for any factor that might explain his remarkable recovery. She had ruled out delayed treatment responses, diagnostic errors, and spontaneous remission patterns. The only variable that correlated with his improvement was the introduction and continuation of meditation practices. David, can you describe exactly what you do during these meditation sessions? Dr. Foster asked during his latest appointment. David explained the breathing techniques, visualization exercises, and deep relaxation methods that Sarah had taught him. He described feeling warmth and energy flowing through his body, particularly around the areas where tumors had been detected. He talked about achieving states of profound peace where he felt connected to his body's healing capacity. I know it sounds unscientific, David said, but I can actually feel the cancer leaving my body during deep meditation. It's like my immune system remembers how to fight when my mind gets out of the way. Dr. Foster documented everything carefully. She had been researching meditation's effects on immune function, cellular repair mechanisms, and genetic expression related to cancer growth. The emerging science suggested that deep meditative states could indeed influence biological processes in ways that traditional medicine was only beginning to understand. That afternoon, Dr. Foster requested a meeting with Patricia Williams. She brought David's complete file, including detailed documentation of his meditation practices and their correlation with medical improvements. Patricia, I think we need to seriously consider that Mr. Thompson's recovery might be related to the meditation techniques his former nurse taught him, Foster said. The timeline is too precise to be coincidental. Williams had been wrestling with the same conclusion. David's case had become the talk of the hospital, with medical staff discussing the unexplained recovery in hushed tones. Some viewed it as a medical miracle, others as a diagnostic mystery, but few were willing to consider that a nurse's unauthorized healing methods might have contributed to the outcome. Amanda, even if the meditation helped, we can't acknowledge that officially. Dr. Martinez would see it as validation of unscientific practices, and it would undermine the decision to terminate Sarah Chen. But what if we're wrong? What if we fired a nurse who discovered something important about healing? What if other patients could benefit from these techniques? Williams understood the implications. If Sarah's methods had contributed to David's recovery, the hospital had not only terminated an effective healer, but had also missed an opportunity to explore innovative treatment approaches. Dr. Foster continued pressing her case. I'd like permission to document David's meditation practices formally and perhaps explore whether other patients might benefit from similar interventions. Williams agreed to consider the request, but she knew the political complexity of the situation. Acknowledging the potential value of Sarah's methods would require admitting that the hospital had made an error in judgment. Meanwhile, David's recovery was attracting attention beyond Riverside General. Dr. Rachel Kim, a renowned researcher in integrative oncology from the University of Chicago, had heard about the case through professional networks. Spontaneous remissions in pancreatic cancer were so rare that each case warranted careful study. Dr. Kim contacted Patricia Williams directly, requesting permission to interview David Thompson and review his complete medical records. She was particularly interested in any non-medical factors that might have contributed to his recovery. Mrs. Williams, I understand this is a sensitive situation, but Mr. Thompson's case could contribute significantly to our understanding of mind-body healing mechanisms. If there are reproducible factors in his recovery, they could potentially help other patients. Williams found herself in an increasingly complex position. Denying Dr. Kim access to David's case would appear suspicious and unscientific. Allowing the review might expose the hospital's hasty decision to terminate Sarah Chen. Dr. Kim arrived at Riverside General 3 days later, accompanied by a research assistant and advanced monitoring equipment. She conducted a comprehensive interview with David and Margaret, documenting every aspect of his healing journey. Mr. Thompson, can you walk me through your meditation practice step by step? Dr. Kim asked. David demonstrated the breathing techniques Sarah had taught him, explaining the visualization exercises in detail. Dr. Kim observed carefully, noting the immediate changes in his heart rate variability, blood pressure, and oxygen saturation during the meditation. These physiological responses are consistent with what we call the relaxation response, but they're more pronounced than we typically see. Dr. Kim observed, how long can you maintain these states? Sometimes for hours. Once I learned how to access that deep place, it became easier to stay there. It's like my body remembers how to heal when I'm in that state. Dr. Kim connected David to portable monitoring equipment and observed his biomarkers during an extended meditation session. What she documented surprised even her. David's immune system activity increased measurably during deep meditation. His inflammatory markers decreased in real time, and his cellular repair mechanisms appeared to accelerate. Margaret, you mentioned that a nurse taught David these techniques. Can you tell me about her background and training? Margaret described Sarah's approach, her gentle guidance, and her obvious knowledge of mind-body healing principles. She saved David's life, Dr. Kim, not just with medication, but by teaching him how to heal himself. Dr. Kim requested Sarah's contact information. I'd very much like to speak with this nurse about her methods and training. That evening, Sarah received a call that would change her life trajectory completely. Ms. Chen, this is Dr. Rachel Kim from the University of Chicago. I've been studying Mr. Thompson's remarkable recovery, and I understand you taught him the meditation techniques he's been using. Sarah was cautious. Yes, I did, though I should mention that I was terminated from Riverside General for those activities. I'm aware of the circumstances, and I'm calling because your methods appear to have contributed to one of the most documented cases of rapid cancer remission I've encountered in 20 years of research. Sarah felt her world shifting. Are you saying the meditation actually helped his recovery? I'm saying that the correlation between your interventions and his improvement is too strong to ignore. Ms. Chen, I'd like to offer you a position with our integrative oncology research team. We need someone with your practical experience and intuitive understanding of mind-body healing. Sarah sat down heavily. Dr. Kim, I'm not even employed as a nurse right now. Riverside General made it clear that my methods were unscientific and potentially dangerous. Riverside General made a mistake. Your methods may represent the future of cancer treatment. We're conducting clinical trials on meditation-based interventions, and we need practitioners who understand how to teach these techniques effectively. Dr. Kim explained that the University of Chicago was launching a comprehensive study of mind-body healing approaches for cancer patients. They had funding for a full-time position developing and implementing meditation-based therapeutic protocols. The starting salary is $15,000 more than you were making at Riverside General, plus research bonuses and opportunities for professional development. More importantly, you'd be working with patients who are specifically seeking integrative approaches to healing. Sarah felt tears forming. Dr. Kim, 3 weeks ago I was told that everything I believed about healing was wrong and potentially harmful. Now you're offering me a position to research and develop these same approaches. Science evolves, Ms. Chen. What seemed impossible yesterday becomes tomorrow's standard of care. David Thompson's recovery suggests that your instincts about mind-body healing were correct. They arranged to meet the following week to discuss the position details and Sarah's role in the research program. As Sarah hung up the phone, she realized that her termination from Riverside General had not ended her healing career, but had redirected it towards something more significant. Dr. Kim's call set in motion a series of events that would ultimately vindicate Sarah's approach and challenge the medical establishment's understanding of healing. David Thompson's recovery had caught the attention of researchers, journalists, and healthcare innovators who were eager to understand how meditation had contributed to such extraordinary results. Within days, Dr. Kim's preliminary findings were circulating through academic medicine networks. The University of Chicago issued a press release about their new research program and David Thompson's unprecedented recovery. Medical journals began requesting case studies, and healthcare conferences started inviting presentations about mind-body cancer interventions. Patricia Williams read the press release with growing unease. The University of Chicago was describing Sarah Chen as a pioneering practitioner whose innovative methods had contributed to a remarkable cancer remission. The same nurse Riverside General had terminated for unauthorized therapeutic practices was now being celebrated as a healthcare innovator. Dr. Martinez was even more disturbed by the developments. The medical community's interest in David's case implicitly validated the meditation methods he had worked to suppress. Worse, the attention was making Riverside General appear behind the times for dismissing such approaches. The media attention was building rapidly. Local news stations picked up the story of the cancer patient whose meditation practice had led to unprecedented recovery. Healthcare bloggers and wellness websites began discussing the case as evidence that mind-body healing deserved serious medical consideration. Sarah found herself at the center of a growing movement toward integrative cancer care. The University of Chicago position would give her a platform to research, develop, and teach the healing approaches she had discovered through her work with David Thompson. But the real validation was yet to come. David's continued recovery and the growing scientific interest in his case were about to attract attention from the highest levels of healthcare administration and government health agencies. Sarah's dismissal from Riverside General was about to become a case study in how established medical institutions could miss breakthrough healing innovations. The nurse who had been fired for practicing unauthorized meditation was about to become a nationally recognized expert in mind-body cancer treatment, and her former employer was about to face uncomfortable questions about their decision to suppress rather than study her methods. David Thompson's miraculous recovery had set in motion forces that would ultimately transform not only Sarah's career, but also the broader understanding of what was possible in cancer treatment and healing. The Grand Auditorium at Northwestern University Medical School buzzed with anticipation as over 400 healthcare professionals, researchers, and medical students gathered for what had been billed as a groundbreaking presentation on integrative cancer therapy. Sarah Chen stood backstage, adjusting her new University of Chicago research badge and taking deep breaths to calm her nerves. 6 months ago, she had been a terminated nurse with an uncertain future. Today, she was about to address some of the most influential minds in American medicine. Dr. Rachel Kim approached with final updates on their presentation materials. Sarah, the preliminary data from our meditation therapy program is remarkable. We now have documentation from 47 cancer patients showing measurable improvements correlating with mind-body practices. David Thompson's case wasn't an anomaly, it was a preview. Sarah reviewed the research slides one final time. The University of Chicago's integrative oncology program had expanded rapidly since her arrival, attracting patients from across the Midwest who were seeking alternatives to purely conventional treatment. Sarah had developed standardized meditation protocols, trained other practitioners, and documented healing outcomes that were reshaping how progressive medical centers approached cancer care. The media attention has been incredible, Dr. Kim continued. 60 Minutes wants to do a feature story. The New England Journal of Medicine is publishing our case studies, and 3 major cancer centers have contacted us about implementing similar programs. The audience settled as Dr. Kim took the podium to introduce Sarah. Ladies and gentlemen, 6 months ago, a nurse at Riverside General Hospital was terminated for teaching meditation to a dying cancer patient. That patient experienced one of the most documented spontaneous remissions in medical literature. Today, that nurse has become one of our leading researchers in mind-body cancer therapy. Please welcome Sarah Chen. Sarah walked to the podium, feeling the weight of hundreds of expectant faces. She began with David Thompson's story, explaining how his terminal diagnosis had led to their exploration of meditation as a complementary healing approach. She described the techniques they had developed together and the unprecedented recovery that followed. Traditional medicine told us that stage 4 pancreatic cancer was essentially a death sentence, Sarah explained. David Thompson's body told us something different. When we gave his immune system the support of deep relaxation and focused intention, it remembered how to fight the disease effectively. She presented slides showing David's before and after scans, his tumor marker progressions, and the timeline correlating his meditation practice with medical improvements. The audience was captivated by the clear documentation of what appeared to be meditation-induced healing. Dr. James Morrison from Johns Hopkins raised his hand during the question period. Ms. Chen, while Mr. Thompson's recovery is remarkable, how do we know the meditation caused the improvement rather than simply coinciding with it? Sarah had anticipated this question. Dr. Morrison, that's exactly why we've expanded our research beyond a single case study. Our current program includes 47 patients with various cancer types, all practicing similar meditation protocols. We're seeing consistent patterns of improved immune function, reduced inflammatory markers, and in many cases, tumor reduction or stabilization. She presented aggregate data showing statistical correlations between meditation practice intensity and positive medical outcomes. The research was compelling enough to silence most skeptics in the audience. Dr. Patricia Williams sat in the back of the auditorium, watching Sarah's presentation with a mixture of admiration and regret. She had driven up from Chicago specifically to hear Sarah speak, knowing that this moment represented a complete vindication of the nurse her hospital had dismissed. Following Sarah's presentation, the audience erupted in sustained applause. During the networking reception, Williams approached Sarah with obvious discomfort. Sarah, congratulations on your remarkable work. Your presentation was truly inspiring. Sarah recognized her former administrator immediately. Mrs. Williams, I'm surprised to see you here. I wanted to hear your presentation and to apologize personally for how Riverside General handled your situation. Watching your research today, it's clear that we made a serious error in judgment. Sarah appreciated the gesture, though it couldn't undo the months of uncertainty and financial stress she had endured. "I understand you were in a difficult position, Mrs. Williams. Dr. Martinez was concerned about liability and protocol compliance. Dr. Martinez has actually been following your research closely. David Thompson's recovery forced him to reconsider some of his assumptions about complementary healing approaches. He's expressed interest in learning more about meditation-based interventions." This surprised Sarah significantly. Dr. Martinez is interested in mind-body medicine. Reluctantly, but yes. When 47 patients show similar improvements, even the most traditional physicians have to acknowledge that something significant is happening. Williams paused, clearly struggling with her next words. "Sarah, I'm here to offer you your position back at Riverside General with a promotion to Director of Integrative Nursing Services. The hospital board has approved a new department focused on complementary healing approaches, and we want you to lead it." Sarah felt a familiar dizziness. "You're offering me a job after terminating me for the same practices you now want me to direct. I know how it sounds, but David Thompson's case has changed everything. We've had dozens of cancer patients specifically requesting the meditation therapy that you developed. Our competitor hospitals are already advertising mind-body healing programs. We need to catch up, and we need someone with your expertise and experience." Sarah considered the offer carefully. Returning to Riverside General would provide a certain satisfaction, but it would also mean leaving the University of Chicago research program, where she was making groundbreaking discoveries about healing. "Mrs. Williams, I appreciate the offer, but I'm committed to my research work here. We're on the verge of discoveries that could transform cancer treatment globally. I can't abandon that to return to an institution that dismissed these approaches until they became financially advantageous." Williams understood but pressed further. "We're prepared to offer you complete autonomy over the integrative medicine department, a 40% salary increase, and funding for your own research initiatives. You could continue your work while also bringing these healing approaches to the patients who need them most." Sarah agreed to consider the offer, but her heart was with the research mission at the University of Chicago. She had found her calling in developing and studying mind-body healing approaches, and she wasn't ready to return to the traditional hospital environment that had initially rejected her methods. 3 weeks later, Sarah received a phone call that would elevate her story to national prominence. Senator Catherine Walsh, David Thompson's sister, had been following his recovery closely and had become a passionate advocate for integrative medicine research. "Ms. Chen, I'm calling to invite you to testify before the Senate Subcommittee on Health, Education, Labor, and Pensions. We're conducting hearings on innovative approaches to cancer treatment, and your work with my brother represents exactly the kind of breakthrough we need to support." Sarah was stunned. "Senator Walsh, I'm honored by the invitation, but I'm not sure I'm qualified to address the Senate on healthcare policy." "Ms. Chen, you saved my brother's life using methods that traditional medicine had overlooked. Your research is demonstrating that healing involves more than just pharmaceuticals and surgery. Congress needs to hear about approaches that could help millions of cancer patients." The Senate hearing was scheduled for the following month, with Sarah as the lead witness on integrative cancer therapy. The hearing would be televised nationally and would provide a platform for discussing mind-body healing approaches at the highest levels of government. As news of Sarah's upcoming Senate testimony spread, media attention intensified dramatically. The nurse who had been fired for teaching meditation to a dying patient was about to advise the United States Senate on cancer treatment policy. The irony was not lost on healthcare observers who had watched Sarah's journey from termination to national recognition. David Thompson, now in complete remission with no detectable cancer markers, agreed to testify alongside Sarah. His recovery had been so thoroughly documented that medical skeptics could no longer dismiss the correlation between meditation practice and healing outcomes. The day of the Senate hearing arrived with significant media coverage. C-SPAN broadcast the proceedings live, while major news networks provided analysis and commentary. Sarah sat at the witness table wearing a navy blue suit, her University of Chicago research credentials prominently displayed. Senator Walsh opened the hearing by describing her brother's remarkable recovery and the role that Sarah's meditation protocols had played in his healing. She emphasized that integrative approaches could complement rather than replace conventional cancer treatment. Ms. Chen, Senator Walsh began, can you explain to the committee how meditation practices might enhance traditional cancer therapy? Sarah spoke clearly and confidently about the physiological mechanisms underlying mind-body healing. She described how deep relaxation could enhance immune function, reduce inflammatory responses, and potentially influence cellular repair processes. Senators, meditation doesn't replace chemotherapy or radiation, but it can make these treatments more effective while reducing their side effects. Our research shows that patients who practice meditation alongside conventional treatment have better outcomes, fewer complications, and improved quality of life. Senator Robert Hayes from Texas, known for his skeptical approach to alternative medicine, challenged Sarah's claims. Ms. Chen, isn't there a risk that patients might delay or avoid proven treatments in favor of meditation, potentially costing lives? Sarah had prepared for this question. Senator Hayes, our protocols always emphasize that meditation is complementary to, never a replacement for, established medical care. We work closely with oncologists to ensure that patients receive comprehensive treatment that addresses both the physical and psychological aspects of cancer. David Thompson's testimony was particularly powerful. He described his journey from terminal diagnosis to complete remission, emphasizing how meditation had given him tools to cope with treatment while potentially enhancing his body's healing capacity. Senators, 6 months ago, I was preparing to die. Today, I'm cancer-free and healthier than I've been in years. Meditation didn't cure my cancer by itself, but it gave my body the support it needed to fight effectively. The hearing concluded with unanimous committee support for increased funding for integrative cancer research. Senator Walsh announced new legislation that would provide grants for hospitals and medical schools developing mind-body healing programs. Following the Senate hearing, Sarah's profile rose to national prominence. She appeared on major talk shows, contributed to health magazines, and consulted with cancer centers across the country. The University of Chicago announced a new Sarah Chen Institute for Integrative Oncology, with funding to research mind-body healing approaches for various diseases. Dr. Martinez, watching Sarah's television appearances from his office at Riverside General, finally understood what the hospital had lost when they terminated her. Her methods weren't unscientific nonsense, but cutting-edge approaches that the medical establishment was finally ready to embrace. He placed a call to Sarah's office at the University of Chicago. Sarah, this is Dr. Martinez from Riverside General. I want to apologize for my opposition to your work with David Thompson. Your research has opened my eyes to possibilities I was too narrow-minded to consider. Sarah appreciated his call, but wasn't surprised by his change of perspective. Dr. Martinez, you were protecting your patients according to your training and experience. I understand why meditation seemed unscientific from a traditional medical perspective. Would you be willing to consult with our oncology department? We're trying to develop our own integrative program, and we need guidance from someone who understands both conventional medicine and mind-body approaches. Sarah agreed to provide consultation services while continuing her primary research at the University of Chicago. She had learned that healing required bridge building between different medical philosophies, rather than choosing sides in ideological battles. David Thompson returned to Riverside General for his 6-month follow-up appointment, where he was greeted as a medical celebrity. His complete remission had become legendary among the staff, many of whom now understood that his recovery involved more than conventional treatment alone. Dr. Amanda Foster, who had supported Sarah's methods from the beginning, was promoted to head the hospital's new integrative oncology program. She invited Sarah to conduct meditation training workshops for nursing staff and physicians interested in mind-body approaches. During one of these workshops, Sarah found herself teaching meditation techniques to the same medical team that had initially opposed her methods. The irony was profound, but not bitter. She understood that medical progress required challenging established assumptions and proved that innovative healing approaches could enhance rather than threaten traditional care. Margaret Thompson attended Sarah's first workshop at Riverside General, watching with joy as the nurse who had saved her husband's life taught other healthcare providers the techniques that had transformed their family's experience with cancer. "Sarah, seeing you here teaching the doctors and nurses who once opposed your methods feels like justice finally being served," Margaret said after the session. Sarah smiled, looking around the familiar hospital rooms where her healing journey had begun. "Margaret, this isn't about justice or vindication, it's about healing. David's recovery showed us that the body has wisdom we're still learning to understand. If these techniques can help other patients the way they helped David, then everything we went through was worthwhile." As Sarah left Riverside General that evening, she reflected on the extraordinary journey that had brought her from a terminated nurse to a nationally recognized expert in integrative cancer therapy. David Thompson's willingness to explore meditation had not only saved his life, but had opened new possibilities for cancer treatment that could benefit thousands of patients. The meditation techniques that had once seemed too unconventional for hospital protocols were now being studied at major medical centers, funded by government grants and taught in medical schools. Sarah's firing had inadvertently launched a career that allowed her to influence healing approaches on a scale she never could have achieved as a staff nurse. 6 months later, the Sarah Chen Institute published groundbreaking research demonstrating that meditation-based interventions could improve cancer treatment outcomes by an average of 37%. The study was featured on the cover of the Journal of Clinical Oncology and established mind-body approaches as evidence-based complementary therapies. David Thompson, now 2 years cancer-free, became a spokesperson for integrative cancer treatment, sharing his story at medical conferences and patient support groups. His recovery remained one of the most thoroughly documented cases of meditation-enhanced healing in medical literature. Sarah's work expanded beyond cancer to include meditation protocols for heart disease, autoimmune conditions, and mental health disorders. The healing principles she had discovered through her work with David Thompson were proving applicable across a wide range of medical conditions. The nurse who had been fired for teaching meditation to a dying patient had become a pioneer in the field that would define the future of healthcare. Her story demonstrated that sometimes the most important medical breakthroughs come not from laboratories or pharmaceutical companies, but from compassionate caregivers willing to see healing possibilities that established medicine has overlooked. Standing before a new group of medical students at Northwestern University, Sarah often concluded her lectures with the same message: healing is an art as much as a science. Sometimes the most powerful medicine we can offer is teaching patients to access their own capacity for recovery. Never underestimate the healing potential that exists within every person you treat. David Thompson's miraculous recovery had proven that meditation could enhance the body's ability to fight cancer, but more importantly, It had shown that healing required practitioners brave enough to explore new possibilities, even when established authorities said those possibilities didn't exist. 2 years after Sarah Chen's groundbreaking Senate testimony, the landscape of American healthcare had fundamentally shifted. The Sarah Chen Institute for Integrative Oncology had become the most prestigious research facility of its kind, attracting patients, researchers, and medical professionals from around the world. What had begun as a nurse teaching meditation to a dying man had evolved into a revolution in how medicine understood the relationship between consciousness and healing. Sarah stood in her corner office at the University of Chicago Medical Center, reviewing applications for the Institute's expanded fellowship program. Medical schools across the country were now requiring courses in mind-body medicine, and young physicians were competing intensely for training positions in integrative approaches. The woman who had once been considered too radical for conventional nursing was now shaping the education of future doctors. Dr. Michael Harrison, former chairman of Riverside General's medical board, had requested a private meeting with Sarah. He arrived at her office wearing the slightly uncomfortable expression of someone about to acknowledge a significant professional misjudgment. "Sarah, I've been following your work since the Senate hearings, and I need to address something that's been weighing on me," Harrison began. 2 years ago, I supported your termination because I believed your methods were scientifically unfounded. Today, the techniques you pioneered are being used in our cancer center with remarkable results. Sarah gestured for him to sit, noting how different this conversation felt from their last interaction when she was defending her practices before the hospital board. "Dr. Harrison, institutional medicine moves slowly by necessity. New approaches always face resistance until the evidence becomes overwhelming. That's generous of you to say, but the truth is, we let our fear of liability override our commitment to exploring healing possibilities. David Thompson's recovery should have prompted investigation, not termination, of the practitioner who facilitated it." Harrison paused, clearly struggling with his next words. "Sarah, I'm here to offer you the position of Chief Medical Officer for Riverside General's new Institute for Healing Sciences. We're investing $12 million in a comprehensive mind-body medicine program, and we want you to design and lead it." Sarah had received similar offers from prestigious medical centers across the country, but this invitation carried particular symbolic weight. Riverside General was offering her the highest medical administrative position in the institution that had once deemed her methods dangerous and unprofessional. The position would give you complete autonomy over research directions, unlimited access to patient populations, and a budget for clinical trials that could reshape cancer treatment globally, Harrison continued. "You'd be reporting directly to the CEO, with authority over both nursing and physician staff." Sarah considered the offer carefully. Returning to Riverside General as Chief Medical Officer would represent the ultimate vindication of her approach, but it would also require leaving the research environment where she had made her most significant discoveries. "Dr. Harrison, I appreciate the extraordinary offer, but my commitment is to advancing the science of mind-body healing rather than managing medical institutions. The research we're conducting here could benefit millions of patients worldwide. I can't abandon that mission for administrative responsibilities." Harrison had expected this response, but pressed further. "What if we could structure the position to maximize your research impact? You'd have access to larger patient populations, more diverse case studies, and resources to conduct multi-site clinical trials." Sarah agreed to consider a consulting arrangement that would allow her to maintain her research focus while helping Riverside General develop their integrative medicine program. The irony of the institution that had fired her now seeking her guidance was not lost on either of them. 3 weeks later, Sarah received news that would elevate her work to international prominence. The World Health Organization had invited her to address their annual assembly on global health innovations. Her presentation would focus on integrative cancer therapy as a model for reducing healthcare costs while improving patient outcomes. Dr. Elena Vasquez from the WHO called personally to extend the invitation. Dr. Chen, your research demonstrates that mind-body approaches can significantly enhance treatment effectiveness while reducing the need for expensive interventions. Developing nations particularly need cost-effective healing strategies that don't rely entirely on pharmaceutical treatments. Sarah's work had indeed shown that meditation-based protocols could reduce chemotherapy side effects, shorten hospital stays, and improve long-term survival rates. For healthcare systems struggling with rising cancer treatment costs, these approaches offered both humanitarian and economic benefits. The WHO presentation would mark Sarah's transition from American healthcare innovator to global health leader. Her techniques were already being implemented in cancer centers across Europe and Asia, with documented success rates that supported widespread adoption. David Thompson, now 3 years cancer-free and serving as patient advocate for the Sarah Chen Institute, accompanied Sarah to Geneva for the WHO assembly. His recovery remained the most thoroughly documented case of meditation-enhanced cancer remission in medical literature. Sarah, when you first taught me breathing exercises in that hospital room, I never imagined we'd be addressing world health leaders about healing techniques, David said as they prepared for the presentation. Your willingness to risk your career to help me has changed medicine globally. Margaret Thompson had also traveled to Geneva, representing the patient families whose lives had been transformed by integrative healing approaches. She would address the assembly about the patient experience of mind-body medicine and its impact on quality of life during cancer treatment. The WHO Assembly Hall buzzed with anticipation as delegates from 194 countries gathered to hear about breakthrough healing approaches. Sarah's presentation was scheduled as the keynote address, reflecting the international significance of her research. Standing before the assembled health ministers, medical researchers, and policymakers, Sarah felt the weight of responsibility for representing not just her own work, but an entire movement toward integrative medicine. Distinguished delegates, 3 years ago, a terminal cancer patient taught me that healing involves more than treating disease symptoms. When we address the whole person, mind, body, and spirit working together, we access healing capacity that conventional medicine alone cannot reach. She presented comprehensive data from 17 countries where meditation-based cancer protocols had been implemented. The results consistently showed improved patient outcomes, reduced treatment costs, and enhanced quality of life measures. Dr. James Chen, director of Singapore's National Cancer Center, raised his hand during the question period. Dr. Chen, while your results are impressive, how do we ensure quality control when implementing meditation protocols across diverse cultural and medical contexts? Sarah had anticipated this challenge. Dr. Chen, we've developed standardized training programs that can be adapted to local cultural contexts while maintaining therapeutic effectiveness. The fundamental principles of breathwork, visualization, and deep relaxation translate across all cultures, though the specific imagery and techniques may vary. She described the Institute's international training initiative, which had already certified meditation therapists in 23 countries. Each program respected local healing traditions while incorporating evidence-based mind-body techniques. The WHO Assembly concluded with unanimous support for a global initiative promoting integrative cancer care. Sarah was appointed as Special Advisor on Mind-Body Medicine, with responsibility for developing implementation guidelines for member nations. Following the Geneva presentation, Sarah's international profile expanded dramatically. She was invited to establish training centers in London, Tokyo, and São Paulo. The healing approaches she had developed with David Thompson were becoming standard practice in progressive cancer centers worldwide. Dr. Rachel Kim, now co-director of the Sarah Chen Institute, had been documenting the global impact of their work. Sarah, we've tracked over 12,000 cancer patients who've participated in meditation-based protocols across 6 continents. The consistency of positive outcomes is unprecedented in cancer treatment research. The data showed average improvement in 5-year survival rates of 42% when meditation was combined with conventional treatment. These results had convinced even skeptical oncologists that mind-body approaches deserved serious consideration. Sarah's work had also attracted attention from technology companies developing digital health solutions. Several firms were creating meditation apps specifically designed for cancer patients, based on protocols she had developed. These platforms would make mind-body healing techniques accessible to patients who couldn't access specialized cancer centers. The nurse who had been fired for teaching meditation to a single patient was now influencing the treatment of millions of cancer patients globally. Her techniques were being taught in medical schools, implemented in hospitals, and prescribed by oncologists who had once dismissed such approaches as unscientific. David Thompson's remarkable recovery had catalyzed a transformation in cancer care that extended far beyond any individual case. His willingness to explore meditation had opened pathways to healing that were revolutionizing medical practice across multiple specialties. Dr. Martinez, who had initially opposed Sarah's methods, most vigorously had become one of her strongest supporters. He now co-taught courses on integrative oncology and frequently spoke about how David Thompson's case had challenged his assumptions about healing. I spent 30 years believing that effective cancer treatment required increasingly aggressive interventions, Martinez explained to medical students. Sarah Chen taught me that sometimes the most powerful medicine involves helping patients access their own healing capacity. Riverside General Hospital had indeed established their Institute for Healing Sciences, with Sarah serving as founding consultant. The program had become so successful that other hospitals were sending staff for training in integrative approaches. Jessica Rodriguez, Sarah's former nursing colleague, now directed the hospital's mind-body medicine nursing program. Watching Sarah's journey from terminated employee to international health leader has inspired our entire nursing staff to think differently about healing possibilities. The meditation protocols developed at Riverside General were showing success, rates that attracted patients from across the Midwest. The hospital that had once fired Sarah for unauthorized therapeutic practices was now marketing itself as a leader in innovative cancer treatment. 5 years after David Thompson's initial diagnosis, Sarah published her definitive textbook on integrative cancer therapy, Healing the Whole Person. Mind-body approaches to cancer treatment became required reading in medical schools and established Sarah as the leading authority on meditation-based healing protocols. The book dedicated its first chapter to David Thompson's recovery, acknowledging that his courage to explore unconventional healing approaches had made all subsequent developments possible. His case remained the foundation upon which an entire field of medicine had been built. Sarah's speaking engagements now took her to medical conferences on every continent. Her presentations consistently drew standing ovations from physicians who had witnessed the transformation in cancer treatment that her work had inspired. At the International Conference on Integrative Oncology in Vienna, Sarah reflected on the journey that had brought her from a small hospital room in Chicago to global health leadership. Colleagues, 6 years ago, I was a nurse following my intuition about healing. Today, mind-body medicine is transforming cancer treatment worldwide. This evolution happened because one patient was willing to trust unconventional approaches and because the medical community was eventually willing to examine evidence over prejudice. Dr. Elena Hoffman from the Vienna Medical University approached Sarah after her presentation. Dr. Chen, your work has inspired a generation of physicians to think beyond traditional treatment boundaries. Medical students today graduate with a completely different understanding of healing possibilities than previous generations. Sarah's influence on medical education had been profound. Young physicians now trained in both conventional oncology and mind-body approaches, seeing them as complementary rather than competing philosophies. The Sarah Chen Institute had established satellite programs at major medical centers across the United States, creating a network of training facilities for integrative cancer therapy. These programs were producing a new generation of healthcare providers skilled in both high-tech medical interventions and ancient healing wisdom. David Thompson, now serving as Executive Director of Patient Advocacy for the Institute, had become a powerful voice for patient-centered healing approaches. His story inspired cancer patients worldwide to explore complementary techniques alongside conventional treatment. Sarah didn't just save my life, David often told audiences. She taught me that healing involves more than surviving disease. It means discovering your body's wisdom and supporting its natural capacity for restoration. Margaret Thompson had also become an advocate for family-centered integrative care, developing support programs for cancer patients' loved ones. Her work emphasized that healing extends beyond individual patients to encompass entire family systems. The meditation techniques that Sarah had quietly taught in a hospital room had evolved into comprehensive healing protocols used by major cancer centers globally. Research funded by the Sarah Chen Institute was exploring applications for heart disease, autoimmune disorders, and mental health conditions. Dr. Amanda Foster, now Chief of Integrative Medicine at Riverside General, regularly consulted with Sarah on expanding mind-body approaches beyond oncology. Sarah's courage to challenge established medical thinking has opened possibilities for healing that we're still discovering. Sarah's work had demonstrated that the most significant medical advances often come from practitioners willing to question accepted limitations and explore healing possibilities that established authorities might dismiss. As Sarah prepared for her next international presentation, she reflected on how David Thompson's recovery had transformed not just their individual lives, but the entire landscape of cancer treatment. The nurse, who had risked her career to teach meditation to a dying patient, had become instrumental in reshaping global approaches to healing. The meditation protocols developed through their collaboration were now helping thousands of cancer patients access healing resources they might never have discovered through conventional treatment alone. David's recovery had proven that the body possesses wisdom that medical science is still learning to understand and support. Standing in her office overlooking the University of Chicago campus, Sarah felt profound gratitude for the journey that had brought her from a terminated nurse to a global health leader. Her story demonstrated that the most important medical breakthroughs often emerge from practitioners willing to prioritize patient healing over institutional conformity. The revolution in integrative cancer care that began with a simple meditation session in room 714 at Riverside General Hospital had transformed how medicine understood the relationship between consciousness and healing, proving that sometimes the most powerful interventions are those that help patients remember their own capacity for recovery and restoration. The autumn sun filtered through the windows of the newly constructed Sarah Chen Center for Consciousness and Healing at Harvard Medical School, where Sarah stood before an audience of the world's most distinguished physicians, researchers, and Healers. 7 years had passed since that transformative night in room 714, and the ripple effects of David Thompson's recovery had evolved into a tsunami of change that was reshaping medicine globally. Sarah's hair now showed threads of silver, and her presence carried the gravitas of someone who had fundamentally altered how humanity understood healing. The auditorium was packed beyond capacity, with medical luminaries from Oxford, Johns Hopkins, Mayo Clinic, and the most prestigious institutions worldwide gathered to witness the unveiling of the Global Healing Initiative. Dr. Catherine Wright, Dean of Harvard Medical School, introduced Sarah with words that would have seemed impossible just years earlier. Today, we launch the largest collaborative study in medical history, examining consciousness-based healing across 47 countries and involving over 2 million patients. This initiative exists because one nurse had the courage to see possibilities that traditional medicine had overlooked. Sarah approached the podium feeling the weight of transformation that had brought her to this moment. The woman who had once worried about losing her nursing license was now directing a research consortium that would influence healthcare for generations. Distinguished colleagues, we stand at a threshold in human healing, Sarah began, her voice carrying across the hushed auditorium. 7 years ago, we believed that fighting disease required increasingly powerful external interventions. Today, we understand that the most profound healing often emerges when we learn to support the body's innate wisdom. The Global Healing Initiative represented the culmination of Sarah's life work. Research centers on 6 continents would collaborate to study consciousness-based healing across multiple medical conditions, creating the most comprehensive understanding of mind-body medicine ever attempted. Dr. Hiroshi Tanaka from Tokyo University of Medicine raised his hand during the presentation. Dr. Chen, your protocols have shown remarkable success in cancer treatment, but how confident are we that these approaches will prove equally effective across other disease categories? Sarah had spent months preparing for such questions. Dr. Tanaka, our preliminary studies in cardiovascular disease, autoimmune conditions, and neurological disorders show similar patterns of improvement when consciousness-based techniques are integrated with conventional treatment. The fundamental principle remains consistent. Supporting the body's natural healing intelligence enhances therapeutic outcomes across all conditions. She presented data from pilot programs in cardiac rehabilitation, multiple sclerosis treatment, and Alzheimer's care, all showing significant improvements when meditation protocols were incorporated into standard medical practice. The evidence was becoming undeniable that healing involved consciousness as much as chemistry. David Thompson, now recognized as the most famous cancer survivor in medical history, sat in the front row beside Margaret. His complete recovery had been documented in over 200 medical publications, making him a living testament to the power of integrative healing approaches. Dr. Benjamin Foster, David's current physician and son of Dr. Amanda Foster, leaned over to whisper, "Mr. Thompson, your recovery sparked a revolution that's now changing how we treat millions of patients. How does it feel to know your healing journey has influenced global medicine?" David smiled, remembering the desperate night when Sarah first taught him to breathe deeply and visualize healing. "Dr. Foster, I never imagined that learning to meditate would transform healthcare worldwide." Sarah saw possibilities in healing that no one else recognized. The Harvard presentation continued with Sarah introducing the initiative's research directors from around the world. Dr. Maria Santos from São Paulo would lead studies on consciousness-based approaches to infectious diseases. Dr. James Morrison from Oxford would examine mind-body techniques for surgical recovery. Dr. Priya Sharma from New Delhi would investigate meditation protocols for maternal and child health. Each research director represented years of training in Sarah's methods, creating a global network of practitioners who understood both rigorous scientific methodology and the subtle art of consciousness-based healing. Dr. Rachel Kim, now co-founder of the Sarah Chen Foundation, presented the financial scope of the initiative. We've secured funding of $2 billion over 7 years from governments, medical institutions, and private foundations worldwide. This represents the largest investment in consciousness research in human history. The funding reflected how completely Sarah's work had transformed medical priorities. Institutions that once viewed mind-body approaches with skepticism were now competing to fund research into consciousness-based healing. Sarah's keynote continued with a deeply personal reflection on the journey that had brought her to this moment. Colleagues, 8 years ago, I was a nurse facing termination for teaching meditation to a dying patient. Today, those same techniques are prescribed by physicians worldwide and taught in every major medical school. She paused, scanning the audience filled with the medical leaders who now championed approaches they had once dismissed. This transformation happened because we learned to listen to patients rather than just treating their diseases. David Thompson taught me that healing involves the whole person, not just their medical condition. The audience erupted in sustained applause, recognizing that Sarah's humility and patient-centered focus had driven one of the most significant advances in medical history. Dr. Patricia Williams, now serving as Chief Strategy Officer for the Sarah Chen Foundation, approached the podium to announce the initiative's first major milestone. We're pleased to report that meditation-based protocols are now standard practice in over 8,000 hospitals globally, with documented improvements in patient outcomes that have saved an estimated 350,000 lives. These numbers represented more than statistics. They represented families who hadn't lost loved ones, patients who had found healing they never expected, and healthcare systems that had discovered more effective and compassionate approaches to treatment. Sarah's influence extended far beyond medical institutions. Her autobiography, The Healing Path, From Nurse to Global Health Pioneer, had become an international bestseller, inspiring healthcare workers worldwide to challenge conventional limitations and explore innovative healing possibilities. The book's final chapter, titled David's Gift, detailed how one patient's willingness to trust unconventional approaches had catalyzed a transformation in global healthcare. David Thompson's recovery remained the foundational case study that had launched an entire field of medicine. Speaking engagements now took Sarah to venues that reflected her evolution from healthcare provider to global thought leader. She addressed the United Nations General Assembly on consciousness and world health, delivered the keynote at the World Economic Forum on the future of medicine, and consulted with heads of state on integrating mind-body approaches into national healthcare systems. At each presentation, Sarah emphasized the same core message that had guided her work from the beginning. Healing requires more than fixing broken parts. It involves recognizing and supporting each person's innate capacity for restoration and wholeness. This philosophy had influenced not just medical practice, but medical education. Students now graduated understanding that effective treatment addressed psychological, spiritual, and social factors alongside physical symptoms. Dr. Robert Martinez, Sarah's former adversary at Riverside General, had become one of her most effective advocates. Now, serving as Director of Integrative Oncology at the hospital, he frequently spoke about how David Thompson's case had transformed his understanding of healing. I spent decades believing that rigorous medicine required dismissing approaches that couldn't be easily quantified, Martinez told medical students. Sarah Chen taught me that the most rigorous approach is following evidence wherever it leads, even when it challenges our preconceptions. Riverside General Hospital had indeed become a model for integrative medicine, with Sarah's former colleague Jessica Rodriguez now training physicians from around the world in consciousness-based healing techniques. The meditation protocols that Sarah had quietly developed in room 714 were now taught in medical schools as standard curriculum. Young physicians learned breathing techniques alongside anatomy, studied visualization methods with pharmacology, and practiced presence and compassion as essential clinical skills. Sarah's influence on nursing education had been equally profound. The Sarah Chen Scholarship Program provided full funding for nursing students committed to integrative healing approaches, ensuring that future generations of nurses would graduate with skills in both high-tech medical care and ancient healing wisdom. Margaret Thompson, now serving as patient family advocate for the Sarah Chen Foundation, worked to ensure that consciousness-based healing remained accessible to patients regardless of economic status. Her advocacy had led to insurance coverage for meditation therapy in 37 countries. Sarah didn't just save David's life, Margaret often told audiences. She saved our family's faith in healing and showed us that medicine could be both scientifically rigorous and deeply compassionate. The Global Healing Initiative's research was revealing insights that continued to surprise even Sarah. Studies were showing that consciousness-based techniques could influence genetic expression, enhance immune function, and accelerate cellular repair in ways that conventional medicine was still learning to understand. Dr. Elena Vasquez from the World Health Organization had become a close collaborator, working with Sarah to establish consciousness-based healing as a recognized medical specialty. Dr. Chen's work has demonstrated that healing involves dimensions of human experience that medical science is only beginning to explore. The WHO had officially endorsed meditation-based protocols for cancer treatment, cardiovascular disease, and mental health conditions, representing the first time in history that consciousness-based approaches had received such authoritative medical recognition. Sarah's research was also influencing technology development. Medical device companies were creating biofeedback systems that helped patients access healing states more effectively. Pharmaceutical companies were studying how meditation could enhance drug effectiveness while reducing side effects. The intersection of ancient wisdom and modern technology was producing innovations that Sarah could never have imagined during those quiet sessions with David Thompson. Virtual reality systems now guided patients through healing visualizations. Artificial intelligence monitored consciousness states during treatment, and wearable devices tracked the physiological effects of meditation practice. Yet despite the technological sophistication, Sarah always emphasized that the core of healing remained fundamentally human. Technology can support healing, but it cannot replace the essential human connection between practitioner and patient, she reminded audiences. David Thompson's story had inspired documentaries, academic conferences, and medical textbooks, but Sarah ensured that his humanity remained central to all discussions. David wasn't just a case study, she emphasized. He was a man facing mortality who chose courage over despair, and that choice changed medicine forever. The 8th anniversary of David's diagnosis approached, marking nearly a decade of perfect health since his recovery. Medical experts had initially predicted he would live 2 weeks. Instead, he had become a symbol of healing possibilities that transcended conventional understanding. At the anniversary celebration held at the University of Chicago, Sarah reflected on the extraordinary journey that had transformed her from a terminated nurse into a global health leader whose work influenced millions of patients worldwide. 8 years ago, David Thompson taught me that healing requires both scientific rigor and unlimited compassion, Sarah told the assembled crowd of medical professionals, patients, and advocates. His recovery showed us that the body possesses wisdom we're still learning to understand and support. The celebration included presentations from researchers around the world whose work had grown from Sarah's initial discoveries. Cancer survival rates had improved globally. Treatment costs had decreased in hospitals using integrative approaches, and patient satisfaction scores had reached unprecedented levels. Sarah's legacy extended beyond measurable outcomes to include a fundamental shift in how healthcare providers understood their role. Medical professionals now saw themselves as facilitators of healing rather than just treaters of disease, supporting patients' innate capacity for recovery rather than simply applying external interventions. The nurse who had risked her career to teach meditation to a dying patient had fundamentally altered humanity's understanding of healing possibilities. Her work demonstrated that the most profound medical advances often emerge from practitioners willing to prioritize patient well-being over institutional conformity. As Sarah concluded her anniversary remarks, she returned to the simple truth that had guided her throughout the journey. Healing happens when we remember that every patient carries within them the seeds of their own recovery. Our job is to create conditions where that healing can flourish. David Thompson's miraculous recovery had proven that those seeds could bloom even in the most unlikely circumstances, transforming not just individual lives, but the entire landscape of global healthcare. The meditation techniques developed in a quiet hospital room had evolved into a movement that was reshaping how humanity approached healing, proving that sometimes the most powerful medicine emerges from the courage to see possibilities that others have overlooked. The revolution in consciousness-based healing that began with Sarah's simple act of compassion continued to expand, touching millions of lives and demonstrating that healing involves not just treating disease, but nurturing the whole person's capacity for restoration, resilience, and renewal. 10 years had transformed the world of medicine in ways that once seemed impossible. Sarah Chen stood in the garden of her private retreat center, nestled in the mountains of Colorado, watching the sunrise paint the peaks in shades of gold and rose. At 43, she had achieved more than most medical professionals could imagine in several lifetimes, yet her greatest satisfaction came from the quiet moments of reflection that reminded her why she had entered healing in the first place. The Sarah Chen Healing Sanctuary had become a pilgrimage destination for healthcare workers from around the globe who sought to deepen their understanding of consciousness-based medicine. The center offered month-long immersion programs where physicians, nurses, and therapists learned not just techniques, but the philosophy behind integrative healing approaches. Dr. Lisa Park, a young oncologist from Seoul National University, approached Sarah as she completed her morning meditation beside the reflection pond. Dr. Chen, I wanted to thank you before I returned to Korea. This month has completely transformed how I understand my role as a physician. Sarah smiled, remembering her own journey of discovery that had begun in much less serene circumstances. Dr. Park, what will you take back to your patients that you didn't have when you arrived? The understanding that healing is a partnership between practitioner and patient, not something I do to them, but something we create together. The meditation techniques are powerful, but the shift in perspective is what will really change my practice. This conversation repeated itself weekly as healthcare professionals from every continent completed their training at the sanctuary. Sarah had designed the programs to address not just clinical skills, but the inner development that effective healing required. The center's most popular program remained the David Thompson Fellowship, a 6-month intensive training that combined advanced consciousness-based healing techniques with direct mentorship from Sarah herself. Fellows worked with cancer patients, documented outcomes, and contributed to the growing body of research that continued to expand understanding of mind-body medicine. Dr. James Thompson, David's younger brother, who had been inspired by his siblings, Recovery to pursue medicine had just completed his fellowship and was preparing to establish similar programs in rural hospitals across Montana. Sarah, watching David's transformation led me to medical school, but training here has taught me that healing involves much more than I ever imagined. The ripple effects of David's recovery continued expanding in unexpected directions. His daughter Emma, now completing her residency in integrative pediatrics, was developing meditation protocols specifically designed for children facing serious illnesses. Margaret Thompson had written a best-selling memoir about their family's healing journey that had inspired thousands of families dealing with cancer diagnoses. Sarah's influence on medical education had reached into the most traditional institutions. Harvard Medical School now required all students to complete coursework in consciousness-based healing. Johns Hopkins had established the Thompson Center for Mind-Body Medicine. Mayo Clinic offered board certification in integrative approaches that Sarah had helped design. The transformation wasn't limited to prestigious medical centers. Community hospitals in rural areas, urban clinics serving underserved populations, and international medical missions were implementing consciousness-based protocols that dramatically improved patient outcomes while reducing costs. Dr. Maria Rodriguez, who directed the mobile healing unit that brought integrative medicine to remote villages in Guatemala, video called Sarah during her weekly consultation session. Sarah, we're seeing remarkable results, even in areas with limited medical resources. Teaching patients breathing techniques and visualization is helping them heal from conditions that previously seemed hopeless. These global implementations proved that consciousness-based healing wasn't dependent on expensive technology or elaborate facilities. The most profound healing tools were accessible to anyone willing to learn basic techniques and practice them consistently. Sarah's research had evolved beyond clinical outcomes to explore the deeper mechanisms underlying consciousness-based healing. Her latest studies were investigating how meditation practices influence quantum-level cellular processes, opening new frontiers in understanding the relationship between consciousness and biological function. Dr. Michael Zhao from Stanford's Quantum Biology Institute collaborated with Sarah on research that was challenging fundamental assumptions about how healing occurred. Sarah, our preliminary findings suggest that consciousness may influence biological systems through quantum coherence effects that we're only beginning to understand. This cutting-edge research attracted physicists, neuroscientists, and consciousness researchers who were discovering that healing involved dimensions of reality that conventional medicine had never considered. Sarah found herself at the intersection of ancient wisdom and quantum science, exploring healing possibilities that transcended traditional medical categories. The annual Global Healing Conference, now in its 5th year, attracted over 15,000 participants from 93 countries. This year's conference in Zurich featured presentations on consciousness-based approaches to genetic disorders, neurological conditions, and even aging processes. Sarah's opening address to the conference reflected on the decade-long journey that had brought consciousness-based healing from the margins of medicine to its center. Colleagues, 10 years ago, we learned that teaching meditation to a dying patient could catalyze recovery that defied medical explanation. Today, we understand that consciousness is not separate from healing, but fundamental to it. The conference showcased innovations that continued to surprise even Sarah. Researchers in Tokyo had developed meditation protocols that helped stroke patients recover neurological function. Scientists in Copenhagen were using consciousness-based techniques to treat genetic disorders. Physicians in Cape Town had created community healing programs that addressed both individual illness and collective trauma. David Thompson, now serving as the conference's honorary president, delivered a keynote that brought the audience to its feet. 10 years ago, I was given 2 weeks to live. Today, I'm healthier than I've been in decades and have witnessed the healing approaches that saved my life, transform medicine globally. His presentation included video testimonials from hundreds of patients whose lives had been transformed by consciousness-based healing. Cancer survivors, heart disease patients, individuals with autoimmune conditions, and families dealing with genetic disorders all credited meditation-based protocols with their recovery or improved quality of life. The conference also addressed challenges that came with rapid expansion of consciousness-based healing. Dr. Patricia Williams, now directing quality assurance for the Global Healing Initiative, presented standards for practitioner training and patient safety protocols that ensured consistent outcomes across diverse cultural contexts. As consciousness-based healing becomes mainstream, we must maintain the rigorous standards that distinguish effective healing from wishful thinking, Williams emphasized. Sarah's work succeeded because it combined ancient wisdom with scientific rigor. Sarah's influence extended beyond healthcare into education, business, and social policy. Companies were implementing meditation programs for employee wellness that reduced healthcare costs while improving productivity. Schools were teaching breathing techniques and mindfulness practices that enhanced learning and emotional regulation. The Sarah Chen Institute for Leadership and Healing had trained over 2,000 executives, educators, and community leaders in consciousness-based approaches to organizational transformation. These leaders were creating healing-centered institutions that prioritized human well-being alongside traditional performance metrics. Dr. Elena Foster, now directing the Institute's corporate programs, reported remarkable outcomes. Organizations that implement consciousness-based leadership practices show measurably improved employee satisfaction, reduced turnover, and enhanced innovation. Healing principles apply to institutions as well as individuals. Sarah's personal practice had deepened through the years of teaching and research. She spent several hours daily in meditation, often experiencing states of consciousness that provided insights for her work. These experiences reminded her that healing involved accessing wisdom that existed beyond individual knowledge or expertise. The Mountain Retreat Center provided space for Sarah to explore these deeper dimensions of healing while remaining connected to practical applications. She often received insights during meditation that led to breakthrough developments in treatment protocols or research directions. Dr. Rachel Kim visited monthly to collaborate on research and co-author publications that continued advancing the field. Their latest book, Consciousness and Healing: The Science of Mind-Body Medicine, had become the definitive textbook for medical schools worldwide. Sarah, our work has demonstrated that consciousness-based healing isn't alternative medicine, but represents the evolution of medicine itself, Kim observed during one of their walks through the mountain forests. We've proven that addressing consciousness enhances every aspect of medical treatment. The book's publication had coincided with announcement of Sarah's selection for the Nobel Prize in Physiology or Medicine, recognizing her contributions to understanding the role of consciousness in biological healing processes. The award ceremony in Stockholm would honor not just her individual achievements, but the transformation of global healthcare that her work had catalyzed. David and Margaret Thompson would accompany Sarah to Stockholm, representing the millions of patients whose lives had been touched by consciousness-based healing approaches. Their presence would remind the scientific community that healing ultimately served individual human beings seeking wholeness and hope. In her Nobel lecture, Sarah planned to emphasize the collaborative nature of her discoveries. This recognition belongs to every patient who trusted consciousness-based healing, every practitioner who implemented these approaches, and every researcher who contributed to our understanding of mind-body medicine. The Nobel Prize reflected medicine's complete acceptance of consciousness-based healing as legitimate scientific practice. What had begun as one nurse's intuitive response to a dying patient's needs had evolved into a recognized medical specialty, supported by rigorous research and documented outcomes. As Sarah prepared for Stockholm, she reflected on the journey that had brought her from a Chicago hospital room to international recognition as a healing pioneer. The transformation hadn't always been easy, involving personal sacrifice, professional risk, and persistent effort to bridge different approaches to medicine. Yet every challenge had been worthwhile when measured against the lives that had been touched by consciousness-based healing. The techniques that Sarah had quietly shared with David Thompson were now helping millions of patients access their own healing capacity while receiving the best that conventional medicine could offer. The integration of ancient wisdom and modern science that Sarah had pioneered was creating a more complete understanding of healing that honored both measurable outcomes and immeasurable human experiences. Her work had proven that the most effective medicine addressed not just disease, but the whole person seeking health and wholeness. Standing in her mountain garden as evening approached, Sarah felt profound gratitude for the path that had unfolded. From that transformative night when she first taught meditation to a man facing death, David Thompson's courage to explore consciousness-based healing had opened possibilities that continued expanding, touching lives in ways that neither of them could have imagined. The nurse who had risked her career to teach breathing exercises to a terminal patient had become instrumental in humanity's evolving understanding of healing possibilities. Her story demonstrated that the most significant medical advances often emerge from practitioners willing to see beyond conventional limitations and trust the wisdom that exists within every human being seeking restoration and renewal. The meditation techniques developed in room 714 had grown into a global movement that was transforming how humanity approached healing, proving that consciousness and compassion were not obstacles to scientific medicine, but essential components of its fullest expression. Up next, you've got two more standout stories right on your screen. If this one hit the mark, you won't want to pass these up. Just click and check them out.